Hi, everybody. This is Dr. Wright. I am going to be talking about outpatient versus inpatient liposuction. It comes up. This is a question that comes up quite a bit, and there's some a lot of different discussions about it. So I want to drill down into it. So first, let's talk about what is liposuction. Liposuction is a procedure using suction cannulas to remove adipose tissue for cosmetic improvement. It is the most frequent cosmetic surgery that's performed. And then there are derivatives of liposuction, such as lipedema reduction surgery. Now, this is really using some of the similar tools, but there's different techniques. It's geared towards functional improvement and not really a cosmetic result, but can also have a cosmetic result. And so I'm going to lump lipedema reduction surgery into my discussion about liposuction. So where should liposuction be performed? Liposuction can be performed at a hospital or an outpatient facility. And 99% of liposuctions are performed outpatient. Why is that? So outpatient versus hospital. So inpatient or hospital liposuctions are generally performed under general anesthesia. And patients stay overnight in the hospital. It is more expensive. And this is used for more complicated surgeries or surgeries that have multiple procedures, such as adding a breast and surgery to a tummy tuck or a more complicated repairs. So inpatient or hospital is going to be or more patients with more complicated issues. Outpatient, again, is more often using tumescent or local anesthetic. Patients return home the same day, usually less expensive, usually focused on just 2 or 3 surgical areas, and is best for patients who are just generally healthy. So what makes a surgical facility safe? A facility should have procedures in place for minimizing risk of infection and other complications. The specially trained staff with experience. So the surgeon and the staff should have a lot of experience with the surgeries they are performing. And adequate and they should have adequate time. So in a safe facility will take time for the tumescent anesthesia and not rush through the surgery. Outpatient facilities are going to have more time. In a hospital, OR time is very tightly scheduled and under great demand, and so they're going to need to turn over the OR time. Also, the OR staff are going to rotate through and be in and assist in multiple different surgeries, from a knee surgery or gallbladder to a liposuction to an open heart surgery. The staff will rotate through. So what are the risks of hospital liposuction? Hospitals can expose people to unnecessary germs and pathogenic bacteria. Resistant bacteria or superbugs develop and are spread in hospitals. Surgical team members in hospitals may not have experience with liposuction. Depends on what team you get that day. Operating rooms, as I said, have tight schedules, so this can rush through surgical procedures. So is a hospital the safest place for a liposuction? No, and unless you have complicated medical problems or you're having a complicated surgery involving multiple procedures. You're 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 probably going to be best in an outpatient facility. So liposuction is a relatively safe procedure in an outpatient facility, again, when performed where there's policy and procedures to reduce the risk of infection with properly trained surgeon and staff, and with especially with local anesthesia, unless general anesthesia is specifically indicated. Thank you very much for your attention. Please, if you have any questions, please put them in the comment section. Hope this is of some help to you, and hope I'm going to do more.